Low back pain is the leading cause of activity limitation and worker absence through much of the world, imposing high economic demand on the individuals, families, communities, industry, and governments. Primary care providers routinely and frequently send individuals with low back pain for an X-ray, MRI, or a CT scan. Are these imaging referrals needed? Do you need to go for an X-ray or MRI when you have back pain? Can it help diagnose your problem, or can it lead to better treatments? Can it tell you about the cause of your back pain? Keep watching to learn answers to these questions and find out whether you need to go for an X-ray or MRI when you have an episode of back pain. For patients presenting to primary care with low back pain, up to 99% of them have non-specific low back pain. Non-specific low back pain means the back pain is not attributable to a known or a specific pathological cause. The 1% of people with low back pain might have a spinal fracture, the Cara-Iguana syndrome, an infection, or a tumor. These so-called red flag conditions will benefit from an X-ray and MRI to rule out or diagnose these conditions. However, the 99% of people with low back pain do not need imaging. In fact, the imaging might do more harm than good for these people. Here's why. An X-ray or CT scan might put you at risk of unnecessary radiation. Unnecessary X-ray or MRI or a CT scan might increase the wait time for those people who need appropriate imaging done. Moreover, structural changes in the spine are a normal process of aging after age 40. For instance, a good quality systematic review in 2015 found that about 50% of people without low back pain had degenerative changes or a disc bulge in their spine. Also, there's a weak correlation between low back pain intensity and MRI findings. There's also the burden on the system. About 30% of Albertans with non-specific low back pain are sent for unnecessary imaging. 1 in 5 Albertans have low back pain at one point in time. An X-ray costs on average about $400 and an MRI about $700. Therefore, these are millions of dollars wasted every year on unnecessary imaging in Alberta and in Canada. More importantly, a positive finding on an imaging might lead to invasive or unnecessary treatments. A positive finding on an MRI might increase stress levels of patients, leading to higher pain sensitivity, thereby worsening of pain. This places increased pressure on the patient to seek further consultations, take strong pain medications, get cortisone injections, or undergo surgery. One study found that low back patients who underwent early MRI were more likely to have prolonged disability, higher medical costs, and greater utilization of surgery. So as a take-home message, as mentioned earlier, the vast majority of back pain is non-specific low back pain. Non-specific low back pain can be well managed with active rehabilitation. If you have an episode of low back pain, try to minimize bed rest. Active pain management strategies are superior to medication and passive therapies. Engage in an exercise or activity that you enjoy. Yoga and mindfulness-based therapies are helpful. If your back pain is not going away or it is interfering with your function, make sure that you book an appointment with your primary care provider, such as your physiotherapist, so you can go through a holistic assessment and get started with your treatment plan.